Hi, Assalamualaikum. Good day, everyone. So, hope all of you are doing well, right? So, today we are going to continue the subtopic 9.5 about the functions of the large intestine or defecation process. So, after the absorption of nutrient is completed in the ileum, so undigested food, that cell, epithelial cell, fiber, and water will enter the large intestine and move slowly through the peristaltic action. Here is the colon. Colon is also the other name for the large intestine. So the fiber that consists of cellulose wall of the plant. The large intestine will carry out two main functions. The first one for the absorption of water and vitamins, and second one is the formation of feces. The absorption of water and vitamins, the substance that will absorb are the water and mineral salt. The second one is the metabolic byproduct of some bacteria such as vitamin B, vitamin K, and folic acid. Now let we discuss some details about the formations of the feces. After the water is absorbed, the remaining waste is in a semi-solid form and it is called feces. The feces contain dead cells from the inner layer of the intestine, waste products such as bile pigment, bacteria, and toxic substance. The wall of the large intestine will secrete mucus. The functions of this mucus is to smoothen the movements of the feces until the anus. It takes about 12 to 24 hours before entering the rectum. The feces will accumulate in the rectum until the pressure in the rectum is increased. After that, the rectum muscle will contract to expel the feces from the anus, and this process is called defecation. Without further delay, let's continue the subtopic 9.6, which is entitled Balanced Diet. We are going to discuss about the energy value in the food sample. Balanced diet refers to a diet that consists of all 7 food classes in the correct proportion and a balanced quantity according to the individual needs. The 7 food classes consist of the carbohydrate, lipid, protein, vitamins, mineral salt, fiber, and water. Energy value is the total amount of energy released when 1 gram of food is oxidized completely. The energy value in food is measured in the form of heat energy, that is, the unit is kilojoule per gram. The other unit of heat energy is calorie. 1 calorie or 4.2 joule is defined as the quantity of heat energy needed to raise the temperature of 1 gram water by 1 degree Celsius at a pressure. This is the important formula that you must remember how to calculate the energy value of the food. We use the mass of water, or we can use the volume of water times with 4.2 times with the increase in water temperature, divided by the mass of the food sample times 1000. This is the contents of vitamin C in fruit or vegetable juice. The vitamin C content in fruit and vegetable are different. One of the factors that affect the loss of vitamin C content is the temperature. Therefore, fruit or vegetable must be kept at the suitable temperature range to preserve vitamin C. This is the experiment that will be carried out in the class to determine the contents of vitamin C in fruit juice and the vegetable juice. In addition, we are going to discuss the diet modification for special individuals. A balanced diet for each individual will vary according to the lifestyle, health condition, and specific nutritional requirement. So each individual must take wise choice based on a nutrition guide, means what our body needs. So the suggestion for nutritional needs can be made based on the Pinggan Sihat Malaysia. It is one alternative that be carried out by the KKM, Kementerian Kesihatan Malaysia, to illustrate the relative quantity of various food classes in a balanced diet. Excessive food intake that rich in saturated fat can cause health problems such as obesity and cardiovascular diseases. Furthermore, we are going to discuss about the causes of the obesity and the effect of the obesity. Obesity is caused by a storage of excess fat as a result of imbalanced food intake and use of energy. The effect of obesity will affect on the individual who are obese and needs to reduce the intake of carbohydrate and fats, increase the intake of vegetable and fruits. Otherwise, a diet with excessive saturated fat and high cholesterol may cause diabetes mellitus and various cardiovascular diseases such as atherosclerosis and hypertension. It also may cause a heart attack or stroke if not treated. In details, we are going to continue the subtopic 9.7, the health issue related to the digestive system and the eating habits. The adaptations of the digestive system. Obesity is a health issue on the rise throughout the world. Yes, the obesity can be controlled through the diet management and routine program, but obesity also requires medical treatment. The specialist doctor may suggest a surgical procedure to reduce the body weight such as the gastric bypass. The gastric bypass, as you can refer to the diagram here, is involved the reductions of the stomach size using various methods of surgery. Among the short-term effects of this surgery are acid reflux, nausea, vomiting, expanded esophagus, certain food prohibition, and risk of infection. Meanwhile, for the long-term side effects are dizziness, low blood sugar level, malnutrition, means not enough nutrient, stomach ulcer, and defecation process. Here are the health issues that related to the defecation. The most important food class in the defecation process is a fiber. So the intake of diet that high in fiber such as fruits and vegetables can help the process of defecation. This can prevent the health problems such as constipation, colon cancer, rectum cancer, and hemorrhoid. So let me discuss about the functions of the fiber. The fiber will help to stimulate the peristalsis, absorb and expel toxic substance, regulate the absorption of glucose, increase the populations of beneficial bacteria in the large intestine. Besides that, the intake of large amounts of water, means at least 8 glasses per day, can ensure that the feces stay soft and move easily along the large intestine. Next one is the gastritis. The poor eating habit and imbalanced diet can cause the numerous health problems. The gastritis. The gastritis refers to the inflammations and corrosions of the stomach epithelial layer caused by the gastric juice when there is no food in the stomach. The untreated gastritis can result in the gastric ulcer. The cause of the gastritis, including the eating irregular quantities of food at irregular hours and excessive intake of alcohol or painkiller. Anorexia nervosa and bulimia nervosa is diseases that related to the psychology. The anorexia nervosa is quite common among the teenagers, girls who are obsessed with their body weight. The anorexic will avoid food to achieve their ideal weight. They also suffer from the psychological problem and nutrient deficiency because their normal digestive system is affected. For the bulimia nervosa, for people with the bulimia nervosa who are also obsessed with controlling their body weight, they will eat a lot, but then they will vomit out the food that they eat, or they take the laxative that cause the diarrhea. In the long term, the patient may suffer from dehydration, nutritional problems, and eventually cardiovascular diseases or kidney failure. Last but not least is a muscle dysmorphia. Some individuals feel that their size is small with not enough growth, so they subject themselves to extreme weightlifting training and exercise. Sometimes they consume steroid or muscle building supplements. So this health issue is called muscle dysmorphia.